Not all patients need to be seen in a preoperative assessment clinic by an anesthetist. This stage aims to filter patients appropriately. Screening to determine who needs to be seen is achieved by using either a questionnaire or interview, the content of which has been determined with the agreement of the anesthetic department. The process can be carried out in a number of ways: completion of a questionnaire by the patient, nursing or other staff who have received training, or occasionally by the patient's GP. The patients screened who do not need to attend the preoperative assessment clinic to see an anesthetist, have no coexisting medical problems, require no or only baseline investigations, the results of which are within normal limits, see Table 1.2, have no potential for, or history of, anesthetic difficulties, require peripheral surgery for which complications are minimal. On admission, these patients will need to be formally clerked and examined by a member of the surgical team. The most obvious type of patient who fits into this class are those scheduled for day case, ambulatory, surgery. These patients should be seen at the time of admission by the anesthetist, who will confirm the findings of the screening, check the results of any baseline investigations, explain the type of anesthetic appropriate for the procedure, have the ultimate responsibility for deciding it is safe to proceed. Stage 2: the preoperative assessment clinic. The patients seen here are those who have been identified by the screening process as having coexisting medical problems that are well controlled with medical treatment, are previously undiagnosed, for example diabetes, hypertension, are less than optimally managed, for example hypertension, angina, have abnormal baseline investigations, show a need for further investigations, for example pulmonary function tests, echocardiography, indicate previous anesthetic difficulties, for example, difficult intubation, suggest potential anesthetic difficulties, for example obesity, previous or family history of prolonged apnea after anesthesia, are to undergo complex surgery with or without planned admission to the intensive therapy unit, I2, postoperatively. Once again, not all these patients will need to be seen by an anesthetist in the clinic, although it is essential that anesthetic advice from a senior anesthetist is readily available. Those who may not need to be seen by an anesthetist include patients with well-controlled concurrent medical conditions, for example hypertension, asthma. They may need additional investigations that can be ordered according to an agreed protocol and then reassessed. Patients with previously undiagnosed or less than optimally managed medical problems. They can be referred to the appropriate specialist at this stage and then reassessed.